here we are again, of course, with no audience for the reasons we all know in these very strange and rather frightening times for all of us. And instead of our usual 5 panellists, we have 4 in order to have suitable social distancing.
Good evening. I'm a local GP, and unfortunately I've been having to self-isolate for the past week and a half. I've not been able to get remote access to be able to work from home. There's been no testing for NHS staff, and my colleagues on the front line have had to go and buy their own scrubs and eye equipment from DIY stores because the personal protective equipment has not been adequate. I would have thought that these were problems that could have been anticipated and dealt with in advance. I would like to know what specific problems people expect the NHS to have in the next few weeks and months, and what they think can be done in advance to sort them out.
So, Richard, there's 2 aspects to this, isn't there? A, how have we got to this point, and was enough done to stop us getting to this point? And is there anything coming down the track that we need to be preparing for now?
Well, first of all, I receive 20, 30 messages a day from frontline NHS workers across the country telling stories very similar to what Adam was just telling us. And honestly, it's sorry to say this, but it's a national scandal. We shouldn't be in this position. We knew in the last week of January that this was coming. The message from China was absolutely clear that a new virus with pandemic potential was hitting cities. People were being admitted to hospital, admitted to intensive care units and dying, and the mortality was growing. We knew that 11 weeks ago. And then we wasted February when we could have acted. Time when we could have ramped up testing, time when we could have got personal protective equipment ready and disseminated. We didn't do it. I'm hearing that not just personal protective equipment is not available, it's the wrong kind of personal protective equipment. What we have isn't even WHO standard. We're putting our health workers, who we've just all clapped here, in the front lines without the armour they need to defend themselves. They're wearing surgical masks which are not WHO standard. They're wearing thin plastic aprons which are not standard. And they're wearing rubber gloves which only cover their wrists, exposing their arms to danger, jeopardy. That is nothing short of a national scandal. How could we allow this to happen? The hypocrisy of clapping NHS workers and yet the government not supporting them to go into that front line is tragic, and it was preventable. I'm sorry to say, but it was preventable.
So, Robert, we had the Secretary of State for Health on the programme last week, and I questioned him pretty closely about supply of equipment, and Matt Hancock was saying innumerable numbers of lorries were going to be out over the weekend. So obviously we were on Thursday. He said by Sunday, all the hospitals, as far as he could say at that point, all the hospitals will have sufficient personal protective equipment. Here we are, a week on, and no, they don't. And you've heard what Richard has to say.
Well, this is a big challenge, but we are ramping up supply very rapidly, and I'm sorry to hear there's a problem at Shrewsbury Hospital.
Well, you can't be surprised by what you heard, because we've all been hearing it
well,
ever since last week.
I hear that myself, and I'm the Cabinet Minister responsible for local government to look after social care. So I hear it from social care providers as well, because we need to get this equipment not just to hospitals, but to care homes, to pharmacists, to GPs, to people who work in homeless shelters, many different important settings. But we are now getting very significant quantities, tens of millions of items of equipment, from gloves to face masks and to other items of PPE, are now flowing through. This has become, for us, a military operation. You've seen some of the pictures of the armed forces delivering this to hospitals. Supplies are now flowing through. Richard is
shaking his head there.
Well, that's just the case. Supplies are flowing through to hospitals.
OK, well,
now,
tell us tonight, Robert, tell us tonight, because people watching at home, and a number of them will be GPs or working in the healthcare system of social care. When do you think people who need it in the health system will have the correct and sufficient personal protective equipment? When will that be?
Well, I can't give you an exact time. What I do know is that...
So you don't know?
No, well, what I do know is that in the last 48 hours, for example, 25 million packs of gloves have been delivered, 15 million face masks, almost 2 million items of eye protection. So these are very large quantities of equipment.
Sorry.
We probably need much more than that, but we are ramping up production.
I know you think what you're saying is true. I know you believe it, but it's simply not true. I mean, these are the messages that I've had today. The lack of clear guidance and testing is causing huge anxiety. Totally inadequate PPE, being sent like lambs to the slaughter. Inadequate PPE, no scrubs, no testing equipment. Sleepwalking into this totally unequipped and unprepared when we had the luxury of 2 months to prepare that other countries didn't. That's why it's a national scandal.
Well, we need to get much more equipment out there. That is happening. Primarily now, PPE is a logistical question. We've got very large stocks. We need to get it out to the front line. On testing, we're also increasing the amount of testing that's available. Again, we need to go further because this is all about testing. One day last week, I think we reached 8,000 tests. We're averaging somewhat below that. We want to get up to 10,000, then 25,000, ultimately 250,000. There's a huge effort to be done there. And then on the antibody test, which is the other type of test for people who've already had it, there we've ordered 3.5 million of those tests. We're testing the test to ensure that it's reliable. And clearly, as the Chief Medical Officer said, that's very important. There's nothing worse than an unreliable test. But if we can prove that that is reliable, then we have millions of those flowing, and within weeks they should be within the system.
Well, let's just stick to the personal protective equipment for a moment, because that's what Adam was asking about. Humphrey, what's your view on that?
Well, look, firstly, I think what I had to say to Adam, again, a huge thank you for everything that he and the hundreds and thousands of GPs who are in many situations right in the front line of what's going on here. And I've got good friends who are GPs who are doing tests of patients and checking patients in the car parks of their surgeries because it's not safe to bring them inside, who are working double, triple and quadruple shifts sometimes. So a huge thank you to what's going on in that regard. I have to say I have a lot of sympathy with the views that Richard expressed, which it's hard to understand why we got caught as short as we did in this crisis. Why we didn't have the foresight to understand more and to take the steps we could have taken with equipment, with tests and many other aspects of what we need to be ready for this. Now, I'm not talking about long-range planning over 2 or 3 years. I'm saying when we saw it happening in China and then in Italy, which was so close to home. I've got very good friends in Italy with whom I've been on the phone since late January, early February. It was very clear what was happening. I think we've really got to I think the government has to really take away the lessons from that. Of course, that doesn't help now. Now it's all about getting stuff to the front line. And that's a logistics and business problem. And I know a little bit about those sorts of things. That's about making sure that you have so much focus on managing the supplies and flows of product. And I really hope that the government's getting the best help it can there, because that absolutely is a solvable problem. If there are 30 million pairs of gloves or however it is in the country, they absolutely should and can be with people in the front line. Let's get that done.
And let me read you another tweet here from Christopher Luke, who says, I'm a psychiatric nurse working on an acute mental health ward. Myself and many of my colleagues feel our patients and the staff have been all but forgotten about. We have very little in the way of PPE, so personal protective equipment, and mental health hospitals across the country are not equipped for something like COVID-19. There's been no coverage of how mental health hospitals are coping in these circumstances. What provisions are being made for staff and patients in psychiatric hospitals, taking into consideration the level of risk we work with, aside from the risk of catching COVID-19?
Absolutely. I mean, we ask people to do everything to look after us at our most vulnerable. We applaud them, we love their self-sacrifice, but we don't seem to be able to provide the most basic protection. And of course, I mean, my local authority, I know, got 300 masks, gloves, and wipes, but just 300. And they have to work out who's going to get them and who isn't going to get them. And again, going back to the social care workers, the ones on 0 hours contracts, the ones going to the most vulnerable, how many of them can actually have the most basic masks? And of course, as you were saying, actually, that's not of WHO standard anyway. What happens, and the worry is that these very people not only might catch it themselves, but also may themselves be spreaders, which of course is the last thing they want to be. People going into A&E and working in A&E, or cleaners working in A&E, the last thing they want to do is be part of the problem. They want to be part of the solution. And if we're not able to provide those basic things, then clearly we have a big problem. But actually, I think that it is about testing. I mean, again, the head of the WHO said this is all about test, test, test. And whilst the government may have 3.5 million tests to find out if we've had it, we should have had those sorts of numbers, surely, for tests as to whether or not people actually have it at the moment, so that we can know whether or not they ought to be working in A&E, or whether they should be, whether they are spreading it. How can we possibly work out who's catching it and who we might have given it to if we don't know that we've had it ourselves? There's so many people who are not even asked to call 111, but just to look up online what the symptoms are and then self-isolate. So as a country at the moment, we don't seem to have any idea, really, apart from the deaths, as to how many people even have the disease, which does make it really difficult to manage.
I think that's a very good point. I mean, we saw the research that came out from Oxford saying half the country may have it, and we've got others saying, is it 10,000 official tests or is it 200,000? And as a statistician earlier in my life, I would have thought we could have worked out at least some tests in the country that would give us at least a guide to what the penetration rate of the virus is, and that would have been enormously helpful.
I mean,
this is one of the mysteries of the whole outbreak.
Yeah.
That when we knew this was coming late January, early February, the standard public health approach to an epidemic is test, 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 and then in an infectious outbreak, you isolate, you quarantine, you contact trace, you chase down every single contact and test that person too to see if you can stop the lines of transmission. And that's the way you stop the outbreak. We didn't do that.
Isn't the irony?
We forgot the most fundamental principles of outbreak control.
Isn't the irony?
We did do, for example, contact tracing, and actually Public Health England did a fantastic
job
at doing that. To begin with, at that stage in
But why did we
the
stop
virus.
it though, Robert?
Well, we were acting upon expert medical advice, and I appreciate there can be differences of opinion between medics and scientists, and nothing is clear-cut, certainly not in a fast-developing situation like this. But we are guided by them, and the contact tracing that was done for those people, for example, coming from China and other parts of the world in the earlier stages, appears to have been quite successful, actually, in this country, and is held up well by international standards. Now
It
the
hasn't
challenge
stopped
for
the
us,
epidemic, though, has it?
it's difficult for me to judge what impact that's had.
But in fact, the strategy we ended up following was that we wanted to get 60% of the population infected because we made the mistaken judgment that we thought it was a mild infection, and we wanted herd immunity.
The policy that the government's always had,
and then you
advised
had the
by the
U-turn.
Chief Medical Officer and our Chief Scientific Advisor, has been to save as many people's lives as possible. There's never been a strategy what you're describing. That's very unfair.
10 days ago. That message changed 10 days ago. In the early part of the epidemic, it was not the case that the message was protect the NHS and save lives. The message was we're going to manage an epidemic in the population, get to 60%, get to herd immunity. There are many, many examples of people on the record, from the Chief Scientific Advisor to statisticians and modellers as part of SAGE, advising the government, saying that that was the objective. And then you stopped it when you realised that the NHS couldn't cope with the intensive care burden.
The government's policy today is very clear, and that's that we need to all play our part by staying at home. That's the best way to protect the NHS, and that's the way that, within all of our power, we can help to save lives.
It's just that it's 6 weeks too late.
I accept it's government policy now, but don't you agree with me that it's ironic that as a country, we're the country that invented the test, but we seem to be the country without it, and everybody else seems to be able to test, and yet Britain is testing so little?
I don't think that's fair. I mean, there are countries that have tested more than we have, but the testing programme that we have is broadly similar to a number of other major
Can I just
countries.
quote you? Germany is conducting. It's just increased their number of tests actually, because we've heard a lot about how it's not there's just a supply problem, you know, getting enough tests, which sounds absolutely plausible. Germany is somehow seems to be circumventing that supply problem and is now increased its number of tests to 500,000 a week. The UK's tested 90,000 overall. So how is Germany getting past the supply problem and we're not?
Well, what we're trying to do is to ramp up production as quickly as we possibly can. I mean, I think everyone can understand that the NHS, the Department for Health, the industry is working as hard as it possibly can. People are working round the clock to do this. Nobody is, you know, going slow on this.
No,
We're trying
I'm sure
to get
no one's suggesting
as
that.
many tests as possible, and I think there is reason to believe that the testing programme will be able to step up quite significantly in the next week or so. You've seen some positive direction on that, and then the potential, at least, of the antibody test and the millions of those that are available, if it can be proven to be a reliable test, could be a game changer for this.